I'm joined by Professor Angela McLean, Chief Scientific Advisor at the MOD. First, let me give an update on the latest data that we have on coronavirus. And I can report that through the government's ongoing monitoring and testing programme, that as of today, there have now been 1,383,842 tests for coronavirus across the UK, including 84,806 tests yesterday. We know that 194,990 people have tested positive, and that's an increase of 4,406 cases since yesterday. And of those who have tested positive, 29,427 have very sadly died. And our hearts go out to everyone who has lost a loved one throughout the coronavirus challenge. We continue to see evidence of a flattening of the peak of this virus, but as the figures that I've just read out show, it's not over yet. So in the coming days, SAGE will update ministers with their latest scientific advice. And as ever, we will make sure that we continue to be guided by their advice as we take the decisions on next steps in fighting this virus. Alongside the advice that we get from SAGE, our 5 tests remain absolutely key. First, we must continue to boost NHS capacity so that the NHS cannot be overwhelmed. Second, we need to see a sustained and consistent fall in the number of deaths. Thirdly, we must see further reductions in the rate of infection to manageable levels across all different settings and areas. Fourth, we must be confident that the NHS will be able to cope with future demands, including as a result of any changes that we make to existing measures or indeed any new measures that we might wish to take. And fifth, and above all, we need to be confident that any adjustments to the current measures won't risk a second peak of infections that could then overwhelm the NHS. Later on this week, the PM will update the country on the measures and the decisions that we will need to take to protect the NHS, to safeguard the economy, and to avoid the risk of a second peak that will be damaging both for public health but also for jobs and the wider economy. And as we consider the decisions that we will take next to protect life but also to protect our way of life, it's now clear that the second phase will be different. We will need to adjust to a new normal where we as a society adapt to safe new ways to work, to travel, to interact, and to go about our daily lives. We've never experienced anything like this first stage of COVID-19 in terms of the scale of the lives lost, but also the lockdown that it has required. And as we go forward, we want to make sure that the next phase is more comfortable, is more sustainable, and prevents lasting damage to jobs and livelihoods. But we need to be under no illusions. The next stage won't be easy. And if we're going to protect life and preserve our way of life, as I just said, we must continue to be guided by the scientific advice we receive and make sure the next steps that we take are sure-footed and sustainable. Now, before I hand over to Angela to run through the data slides, I want to provide an update on one further feature that coronavirus as a challenge has thrown up for this country and indeed for the whole world. Whilst the vast majority of people and countries have come together and rallied to this international mission to defeat coronavirus, there will always be some who seek to exploit a crisis for their own criminal and hostile ends. We know that cyber criminals and other malicious groups are targeting individuals, businesses, and other organisations by deploying COVID-19 related scams and phishing emails. And that includes groups that in the cybersecurity world are known as advanced persistent threat groups, sophisticated networks of hackers who try to breach computer systems. And we have clear evidence now that these criminal gangs are actively targeting national and international organisations which are responding to the COVID-19 pandemic, which I have to say makes them particularly dangerous and venal at this time. So we're working with the targets of those attacks, with the potential targets, and with others to make sure that they're aware of the cyber threat and that they can take the steps necessary to protect themselves or at the very least mitigate the harm that could be wrought against them. So with that in mind, today the UK's National Cyber Security Centre and the US Cyber Security and Infrastructure Security Agency have published a joint warning about these groups, and we've offered some advice on the cyber criminals and other actors who are seeking to exploit COVID-19 through malicious cyber activity. Our teams have identified campaigns targeting healthcare bodies, pharmaceutical companies, research organisations, and also various different arms of local government. Now, there are various objectives and motivations that lie behind these attacks, from fraud on the one hand to espionage. But they tend to be designed to steal bulk personal data, intellectual property, and wider information that supports those aims, and they're often linked with other state actors. Now, we expect this kind of predatory criminal behaviour to continue and to evolve over the coming weeks and months ahead, and we're taking a range of measures to tackle that threat. So, as we've done today, we'll share advice on the nature of those threats to enable businesses, citizens, and our international partners to better defend themselves against the full range of cyber attack, from hostile states to criminal gangs. Preventative action is often the very best way to deny attackers the opportunities that they're looking for. The National Cyber Security Centre offers a range of practical advice to safeguard against cyber attacks, from things like using the use of online passwords to guidance on what are the trusted sources of online information related to COVID-19, like the gov.uk sites or Public Health England. Now, as well as providing practical advice, the UK will continue to counter those who conduct cyber attacks, and we're working very closely with our international partners to respond to the threats, but also to deter the gangs and the arms of state who lie behind them. We're absolutely determined to defeat coronavirus and also to defeat those trying to exploit this situation for their own nefarious ends.
A question about the death tolls, looking at the official figures that you've just announced and comparing them with figures announced this evening by Italy, it does now seem that the UK has had more deaths from COVID-19 than any other country in Europe. If it does turn out that we are the country that's hardest hit in Europe, what's your reaction to that?
Well, thanks, David. You're asking me to speculate there. All I'd just say is, first of all, 29,427 lives lost is a massive tragedy, something in this country on this scale, in this way, that we've never seen before. And as I said before, my heart goes out to anyone that's lost a loved one. In terms of the comparison that you're suggesting, I, as the scientists have all said, I can remember Patrick Vallance and Chris Whitty talking about this. I don't think we'll get a real verdict on how well countries have done until the pandemic is over, and particularly until we've got comprehensive international data on all-cause mortality. But I think there's 2 points that I'd make about the way the UK has approached things. There are different ways of counting deaths. As we know, we've had that debate in this country. We now publish data that includes all deaths in all settings. And not all countries do that, so I'm not sure that the international comparison works unless you reliably know that all countries are measuring in the same way. And it also depends on how good, frankly, countries are in gathering their statistics. And our own Office of National Statistics is widely acknowledged to be a world leader. And one of the reasons we've embraced that is because we want the transparency, because we are confident and we believe that it's only if we get the full transparency that we'll be in the best place to tackle this virus. So I think it is important, but I don't think you can make the international comparisons you're suggesting at this stage. Not, at least, I don't think you can make them reliably. Angela.
I would just reiterate, I think we have decided that our measure of how things have gone will be age-adjusted all-cause mortality. Because that will capture all kinds of impacts of COVID, not just the COVID deaths. And clearly it will be important to do what we can to make international comparisons. Everybody knows that making international comparisons in such statistics can be difficult. And it may be that that will take some time to sort out, and this isn't over yet.
Dave, do you want to come back on any of that?
On another topic, if I may, last week the Prime Minister suggested that there may be situations where there could be benefits from the public wearing masks. Does that mean that UK government policy on this has changed? And if it hasn't changed, might the public be forgiven for being a bit confused?
Well, of course, you're always trying to tempt us to get one or two steps ahead of the game. The reality is we're considering the SAGE advice. That advice has been nuanced, if I can say it like that. The evidence is rather finely balanced, but we'll make sure that we consider it very carefully. One of the things we don't want to do is give people inaccurate advice or create false confidence or comfort in masks. And also there's a key difference between masks that, for example, the self-made masks that some people around the world are being encouraged to use, and the clinical masks that we need for the NHS. And we do not want to detract from the supplies of masks and other PPE, frankly, going to the front line in the NHS or care home workers. But the wider advice we'll consider and shortly be saying more on.